Hospital simply couldn't function without highly trained and highly skilled hospital pharmacists. Try and imagine a hospital without medicines. It is like imagining a library without books or a restaurant without food. Hospital pharmacists produce personalized medicines, allowing for specific and individual treatment for every patient. They have face-to-face meetings with patients to ensure they understand all the important aspects of medications they are taking. In a nutshell, hospital pharmacists ensure the hospital has the right medicines for the right patients and the right dose, and that they are administered in the right route of administration. They ensure this at all hours of day and night. Patients in the hospital wards have the medicines they need. Pharmacist's role in a hospital might appear straightforward. Simply assess the patients in their care and dispense any drugs that are deemed necessary by the doctors, right? Certainly not. While the delivery of medications is a major part of the role, a role extends far beyond this, as they are seen as a co-member of healthcare team when it comes to delivering patient care. Hospital pharmacists' jobs are unlike community pharmacy or primary care pharmacy in many ways. So what makes a hospital pharmacist's job so different? Hello, my name is Abdulhakam Usman and welcome back to Pharmactivity YouTube channel. Today in this video, I will talk about some few responsibilities and the role of a hospital pharmacist. So please stay tuned to end of this video. And if it is your first time or haven't subscribed to my channel yet, please subscribe to my channel, like, share and comment. Let's go. So now let's look at some key responsibilities of a hospital pharmacist. As you can see on the slide, first we have a medicine management. Medicine management is one of the key roles in a hospital pharmacist's job, as they determine which form of medication best suits each patient. Each decision must be made in a timely and also efficient manner, and it requires significant input from doctors, nurses, and other healthcare professionals. Hospital pharmacists will often monitor the effect of the medication being prescribed by the doctors, and they also counsel their patients on the effect of those prescribed drugs. Another aspect of this role by a hospital pharmacist is to recommend administration routes and dosages, all of which are dependent on an individual's need. Another key responsibilities of a hospital pharmacist is that they act as a source of information. A hospital pharmacist is often a great source of advice for patients. They can also be called often to recommend safe combinations of medicines or solutions to specific patient problems. Hospital pharmacists can offer information on potential side effects. Before administration of any medication, they can share information about those prescribed drugs to the other healthcare professionals and also their patients. And they also check that medicines, if they are compatible with existing medication, to avoid any drug interaction or any other drug-related interactions. They often also monitor the effect of treatment to ensure that they are proven effective, safe, and appropriate to the user. A third key responsibility is monitoring drug charts. As hospital pharmacists are required to work very closely with other members of staff such as physicians, nurses, and even dietitians. So information must be passed in a way that it is clear to understand. While this might seem very simple, right? But performing handovers between shifts has the potential to make this aspect of the role a little more complicated. Anyway, very locally, drug charts provide a vital source of information and act as an efficient method of communication between hospital pharmacists and other members of medical staff. Hospital pharmacists must monitor these charts and ensure that the correct medication is being provided to each patient administered in a hospital. Such information may include which form of medication a patient requires, with options including tablets, injections, ointment, or inhalers. How the medication should be administered must also be communicated. Must be communicated to the nurses, whose responsibility is administration of drugs to the patients, and they can also share this information to their patients before administration of their medications to them. Another key responsibility of a hospital pharmacist is discharging patients. Discharging patient is another important role. A pharmacist play a significant role when the patient are being discharged from the hospital. It is the duty of a hospital pharmacist to keep track of which patients are being discharged and inspect the discharge summary. This requires the pharmacist to inspect the patient's drug chart to ensure that the medication prescribed by the doctor matches that contained in the discharge summary. It is then the responsibility of the pharmacist to dispense the correct medication. In so many hospital pharmacists are also qualified to prescribe medication. However, this is not applied to all. It's not applied to all those in the profession. But in some countries like US, in some hospital facilities and some hospital settings, hospital pharmacists make decisions of which medication should be prescribed to the patient, to the individual patients after they have been diagnosed by the doctors. In some countries only, but not in all other countries all over the world. Last but not the least, among the key responsibilities of a hospital pharmacist that we are going to discuss today in this video is keeping up to date. Pharmacists are expected to remain up to date with all aspects, anything related to the medicines. As with any healthcare job, hospital pharmacists are expected to remain up to date with all aspects of medicines. This includes their usage and any new developments that may occur. To this, hospital pharmacists must use electronic databases and read research papers. This may provide invaluable data that enable pharmacists to learn more about new drugs before recommending that they are purchased by the hospital. Any medicines that come to the market before it's been even used by the hospital, pharmacists must have, at least they should have information related to that medicine. Utilizing these resources regularly will allow hospital pharmacists to remain an excellent source of pharmaceutical advice.